In the beginning, we weren't allowed to wear protective gear because in the beginning we weren't sure what the outbreak was going to be.
You weren't allowed to wear protective gear?
Not the plastic gowns and everything else, because we didn't want to waste things. Because in the beginning, if you remember, we were afraid.
Or was that...
So that was just policies in the hospitals and the long-term care facilities, so that unless we knew that the patient was positive, then you had to wear everything. But going into the room and they were not considered a PUI, a person that was suspected to have the virus, or actual COVID positive, then you would just wear your regular surgical mask. And that was it. After like the third patient that I had a referral for trouble swallowing, I was like,
So did you have to say something?
Yeah, so I had to tell my manager that I was not comfortable. So I actually was the only team member that would have an N95 mask all the time.
Oh my God.
Because for all the other disciplines, for like physical therapy, occupational therapy, the patient would have to wear a mask in order to be working with the physical therapist. But for a speech therapist, the patient can't wear a mask for me.
Right.
I have to look inside their mouth. I have to have them eat and drink, so they can't wear a mask. So for speech therapy, we're considered to be doing aerosolizing work with patients. So they could be coughing in our presence. If they're aspirating foods or liquids, they're going to cough in response to it. So speech therapy is more of an aerosolizing treatment. It's in the air.
Right.
So for speech therapy, we were allowed to wear the N95s and goggles or face shields. So I still wasn't wearing a gown or anything, but I'd be the only therapist wearing an N95 for the 8-hour shift.
And when was that you went to them and were like, hey, I have to wear this?
That was, I think, April.
April, like mid-April or so?
Yeah, mid-April.